Hello everyone. Today we will talk about general information about Alалия. The purpose of the lecture explains the methodological and methodological significance of the course and reason for Alалия. The plan of the topic, the first one, methodological and methodological significance for the course. Second one, causes, localization and mechanism of violation. And the third one is Alалия as a systematic impairment of speech activity. In general, Alалия means absence or underdevelopment of speech due to organic damage to the speech zone of cerebral cortex in the intrauterine or early period of development of the child. The term Alалия from the Greek language means a negation, and lalio it means I say or speech. In translation, the absence of speech or means without speech. In addition to the term Alалия in foreign literature, the following terms can be used, like cognitical aphasia, ontogenic aphasia, developmental aphasia, dysphasia, speech delay, constitutional speech delay, impaired language acquisition, hearing loss. If talk about statistics, we can say that among preschool children, Alалия occurs in about 2%, and among school-age children, about 0.8, 0.4%. Among the boys, the speech disorder is 2 times more common than among the girls. In 1980, Schultes identifies Alалия as a separate speech disorder, but considers it in connection with articulatory disorders. Alалия is contrasted with dyslalia as complete impossibility of articulation, which later became known as anarthria. In classification of Kussmaul, the concept of lollopathy is introduced for general name of articulation disorder, dysarthria and dysalia, as well as diction disorders or dysphasia. To Alалия, Kussmaul referred to causes of disorders that are characterized by complete inability to pronounce articulate sound. Later, the term anarthria was used to refer to this condition. In the 80s of the last century was produced the term aphasia, which replaced the term used by Brock, aphemia, which means cases of loss of speech. The term aphasia has become established in medicine and widely used. Some foreign authors like Orton Travis combine the concept of Alалия and aphasia with the general term child aphasia or developmental aphasia, emphasizing the concepts specific of speech underdevelopment in child in contrast to the loss of speech by adults. In works of different authors, the features of speech development and the structure of the defect in Alалия are revealed based on the application of various criteria. It's like psychological, clinical, physiological, linguistic, or psycholinguistic. Various forms of Alалия are described and the method of speech therapy for various forms of speech under development is developed. Success in the study of Alалия in the works of latest period was achieved due to the fact that researchers in their work began to rely widely on the methodology of complex syndromal approach to the analysis of the defect. The dominant aspect of the psycholinguistic aspect of the study presented in the works of Sabatovich, Kovshikov, and Greenspoon. During a long period of studying Alалия, various assumptions were made about the causes of its occurrence. Cohen, Gutzman, Freschels, and Zeman argued that the leading causes of the disorder is inflammatory or alimentary trophic metabolic pathological process occurring in the intrauterine of early period of child development. But Treitel in 1901 considered that Alalea consequences of insufficient attention and memory. Liebman linked to the inferiority of the speech in Alalea with intellectual insufficiency. Ewing in 1963 pointed to the lack of children's motor image of the word as the leading manifestation in the picture of speech inferiority in brain disorder. Lusinger, Berry, Edinova, Kovshikov in 1985 noted the leading role in the occurrence of Alalea of natural craniocerebral injuries and asphyxia of newborn. Birth, injuries, and asphyxia in some cases are a result of intrauterine pathology. This causes chronic oxygen starvation and leads to the decrease in the function of the respiratory center. Brain cells, and especially the third layer of cortex, which is younger in phylogenetical terms, are the most sensitive to the oxygen starvation. The third layer of cortex gives the rise to the complex system of associative connections that ensure the formation of higher cortical functions of a person, primarily speech and the psycho. Among the etiological factors, there are also intrauterine encephalitis, meningitis, adverse developmental conditions, fetal intoxication, cognitive burden, intrauterine or early life brain injuries, early childhood diseases with brain complications, and so on. Intrauterine pathology leads to diffuse damage to the brain substance. Birth, craniocerebral injuries, and asphyxia of newborn causes more local disorders. Lesion of various areas of cerebral cortex causes disorder of the development of speech and non-speech functional system. Alalea as a systematic violation of speech activity can be considered as an organic violation and the development of speech of central character. With Alalea, there is a delay in the maturation of nerve cells in certain areas of the cerebral cortex. Nerve cells stop their development, remaining as a young immature stage neuroblasts. This brain underdevelopment can be congenital or early occurred in the pre-speech period. Organic brain damage in Alalea occurred in the prenatal or early postnatal period. Alalea, it's not just a temporary functional delay in speech development. Also, the entire process of speech formation in this violation takes place in the conditions of pathological stage of central nervous system. Individual manifestations of Alalea are similar in appearance to the normal development of the child and early stage. Conditional reflex activity of the brain in conditions of underdevelopment corresponds to some extent to the activity in early period of normal formation of children's speech. As a conclusion, we can say that in Alalea there are speech and non-speech symptoms between which there are complex mediated relationships. In the symptoms of disorders with Alalea, language disorders are predominant. Alalea is the systematic underdevelopment of speech in which all components of speech are violated: the phonetic and phonemic side, the lexical and grammatical structure. Among non-speech disorders in Alalea, motor, sensory, and psychopathological symptoms are distinguished. The existing concepts of explaining the mechanism of Alalea are conditionally divided into sensor-motor, psychological, and linguistical. At the end of this lecture, I would like to suggest you to consider these three questions and try to find out the right answer. Thank you for your attention. Here is references. Bye.